if you just joined us. We're live on Channel 5 and also live on My 5. Jasmine and Jeff are with me, and later we're going to be asking, should voting be made compulsory? Fascinated to hear your thoughts on that. But now it's time to call the doctor. Today we're opening up the phone lines for skin conditions. Skin specialist Dr Dev Patel is here to answer all your questions. Everything from rashes to rosacea, eczema to acne, bites to blisters. Anything you want to ask, then pick up the phone and do so. So if you've got something that's worrying you, then 0207 862 2222 is the number that you need. Before we kick off, Jeff, you had you've got something you wanted to share with us.
Yeah, well, when I had quite bad acne as I was going through puberty. Now, my mum never, she liked to get involved with such things. She liked to seek resolutions. And I don't know if I've misremembered this, but my mum got me to see the GP, then a specialist, use this thing called topicycline. Right? Now, I think it must have had a very high alcohol content because I used to go to school and my teachers eventually thought I'd been drinking, which was partly a consequence of my conduct and the swearing. But I just want to check, is this something that you've heard of, Doctor, topicycline, or was
I think...
Was I burning my face off?
Did my first dermatology job, I think...
Yeah, but Jeff is very old.
Yeah, absolutely. I've got something for that later. But I would say, yeah, it's probably had antibiotic in it as well from the name, but I might be wrong. But essentially, the treatment nowadays is mostly topical therapy from the GP, particularly if you're talking about your son, teenager. The alcohol content is just part and parcel of most skin preparations, so that's not necessarily an issue unless you were also drinking at the same time. But
well, it smelled like a cross between vodka and you know that hand sanitizer during COVID, the really strong one. Where you think, should I lick this? But it was. I can remember it used to like sting. It used to sting. Have we moved beyond that?
I mean, we're now focused in my clinic. I focus much more on just routine skincare. Sometimes people they're so keen to do something, they're buying very harsh products, so they might have ingredients that work for acne, but at the same time there's lots of ingredients in there that can actually inflame their skin more. So really you want to bring inflammation down, so a good skincare regime but under expert advice and not overdoing it. And also then, if that's not working, to get something a bit more medicated from the GP surgery.
Well, let's kick off with that, because I know that that's something that quite a lot of people do suffer from, and bizarrely enough, not just in the teenage years. So let's talk a little bit about acne and what people can be doing about it. So you've mentioned a sort of a regulated skincare regime. What would that entail then?
So I mean, there's a lot of ingredients that are mentioned online, salicylic acid in your washes and moisturisers. One of the key things to bear in mind is whatever your skin, whether it's acne, rosacea, eczema, it doesn't matter. I don't really focus too much on whether it's oily, dry, mixed, like most people do, and probably experts would disagree with me, but I actually think we all have a degree of inflammation, and it's about bringing the inflammation down. If you bring inflammation down, your skin's better hydrated.
So we've got an example here. That's kind of pretty. Would you call this a sort of pretty serious acne?
Well, it would objectively would put this probably into the moderate spectrum, but of course we can't forget the mental impact that this has. And actually, I'm always careful saying, look, objectively this is moderate, but actually, one sufferer might really be, we don't want to go out of the house with this.
Yeah, we've got another example as well on slightly darker skin. There we go as well.
Yeah, so this is a bit more severe. So here we're kind of seeing almost what we call cysts and nodules, which is kind of the severe end of the spectrum. This is almost certainly going to scar this patient, which can mean that even in their 50s, 60s, 70s, they could be feeling the psychological impact of what they had maybe earlier in life.
So the advice then for acne, of course, see a specialist, see a skin specialist like yourself, but generally, how would you tackle something like that?
Yeah, so most acne, I'd like to, emphasise is managed in the community and in primary care, general practice surgeries. I would first make sure they're on a good skincare regime, and again, not overdoing it, not overwashing, not using very harsh ingredients, just actually using ingredients that can moisturise well. Non-comedogenic moisturisers are key, because a lot of moisturisers, they just block the hair follicles, which is where all this is stemming from. It's a blockage of the hair follicle, essentially. So, we want moisturiser on the skin, but it needs to be the right one. Apricot kernel oil, for example, is perfect, but you choose another oil and it might block the glands. You want to make sure that you bring the inflammation down. I use growth factors now, which is quite an innovative, novel thing, which we were talking about earlier, and they can really help in a kind of acute setting to try and bring things down. And then I'm not a big fan of antibiotics, and I know I don't wish to put anyone off who's using them, and I think for a lot of cases, they're not actually used necessarily to kill off the bugs in acne, but actually just to bring inflammation down.
Right.
But we are worried about resistance, if people are having the oral medication, then it can affect the gut immunity as well and your microbiome. So I try and do things non-antibiotic route.
And how about things like, I know from, well, I had quite bad acne as well growing up, but things like Roaccutane and all those things, which are pretty serious drugs.
They are. And sometimes, and I think my dermatology colleagues would agree that sometimes there can be too much scaremongering with these. You know, Roaccutane, which is only given through a dermatologist, needs a lot of monitoring, like blood test monitoring.
Yeah.
And there are inevitable side effects like very dry skin, but you know it's effective in about 98% of people. And if you know, there was a study done by I think the British Skin Foundation. I think 20% of acne sufferers have contemplated suicide.
Gosh.
So you know, if someone has a huge impact from their acne, particularly if it's scarring acne, then actually a drug like that and going through 6 months of side effects may well be worth it for the benefit of the rest of their life.
So is acne like an actual medical condition then? Is that the way you see it?
It is, and I'm glad you've mentioned that, because I think society has this perception that a lot of conditions like acne are just cosmetic concerns. Mm-hmm. And actually, they're not. You know, there's an imbalance in the skin, and we all sit on a spectrum of health with our skin. It is an organ. And you know, just like we put care into our heart health and our gut health, skin health also should have the same thing.
It's our biggest organ, isn't it?
Absolutely, absolutely.
Should we take a call?
Yeah, let's do it.
Because people are wanting to get in touch with you, Doctor. So let's speak to Dorothy in the West Midlands. Dorothy, welcome to the show. Good afternoon. What would you like to ask the doctor?
Hello, Doctor. I suffer with skin tags, and they itch and irritate. They're a bit of a problem. Is there anything I know I can have them removed, but what do you suggest?
Yeah, okay, thank you.
Do you want to explain, just for people who might be unfamiliar with what a skin tag might be?
Yeah, so skin tags are you know, benign, tiny little growth, usually tiny little growths. They can sometimes be, you know, almost a centimetre in size, but usually they're a few millimetres in size, and they look like that. They've got a little stalk on them, and they're really just no overgrowth of cells, if you like. So they are benign. We don't need to worry about them, and they typically occur on the neckline. You know, we think maybe things like necklaces and other trauma might be a factor. And yeah, they can be very annoying for people. They can catch on jewellery, they can catch on clothing, and of course a cosmetic concern. Unfortunately, Dorothy, there's no magic cream or lotion or potion that you can use that's going to help, and we know of nothing that can really necessarily prevent their growth.
You can get rid of them, because my mum,
Yes.
Dorothy, had skin tags for many years. This was when she was with my dad, and she was very stressed, and we were convinced it was psychological. She had skin tags. She lived with them for years, but the doctor literally said to us, if you come down to the surgery, I can put a freeze on them and just cut them off. And it was literally a very simple doctor's appointment. We were probably in and out of there in half an hour, and they froze and literally cut them off, and they've never grown back again. So a cream might not work, but a GP can help.
That's how they come off, Doctor.
Yeah, your
off.
GP surgery now will not be able to do them, just so we don't get caught.
This is another thing which has gone, you
Yeah.
know, we were talking a few weeks back about cleaning of ears. That's, again, something that's gone from your GP surgery, so you're going to have to pay for this, aren't you?
So, yeah, and you know, my clinic, we do get a lot of people now, more and more, because the funding's gone. But, yeah, just to reassure you, Dorothy, it's a very simple, easy procedure, as Jasmine said. You're in and out within 20 minutes.
OK, Dorothy, thank you. Doctor, let's move on to another, well, something that affects so many people, that's eczema. We've got a couple of examples here. Let's have a look at one. You can talk us through it. That's behind the legs eczema there. So what is classed as eczema? Is it just extreme dry skin?
Effectively, it is. I mean, again, it is a skin condition, and you've essentially got, obviously, itching is a characteristic symptom.
Yeah.
You've got this sort of red, inflamed patches of skin that aren't well differentiated, and you can't get a clear border around them typically in most eczema. It's fairly symmetrical. Tends to affect behind the knees.
Which is, I think, what we're looking at
here.
Yeah,
so the flexures, as we call them, because it tends to favour the hot areas. Of course, it can affect any part of the body. It can affect the face, and the main thing is the itching. You know, the cosmetic concern is obviously there. You know, maybe 1 in 5 kids suffers with it. About 2/3 of children will grow out of it by the time.
Do we know what causes it? Is some people say it could be diet, it could be stress, it could be.
Yeah.
Do we know what's?
We don't. We don't. If it runs in the family, you're slightly more likely to have it. Years ago, we were told in the medical world, you know, that diet has no part to play in this. But actually now, the recent evidence suggests that if the strongest factor is probably a high glycemic index diet, which is basically where you have very sugary foods, particularly processed foods, maybe because that leads to an increase in certain hormones like insulin, which can then lead to more oil production. And it's the oil that starts the process off in blocking the...
And I want to go to a caller in just a moment, but can you just briefly tell us, treating eczema, how would you treat it?
So the most important thing is moisture.
Right.
So emollients. And 9 out of 10 patients that I see will not be using enough moisturiser. And so I think whatever you're using, you need to use lots of it. If it's dry, if your skin looks dry, you're not using enough.
Right, so keep moisturising. Let's speak to Suki in Middlesex. Suki, what would you like to ask the doctor?
Oh, hi, doctor.
Hello.
I've suffered from psoriasis for 55 years now, and I've been through all the lotions and potions, biological treatments and JAK inhibitors at the moment. My question to you is, how much does diet actually affect psoriasis? Because we're hearing a lot about it at the moment, but the doctors say that's not actually anything to do with diet.
Okay. Suki, thank you for your question. Let's just have a quick look at some psoriasis examples that we've had. There's one. So is this, doctor, is psoriasis classed as sort of extreme eczema, or is it something completely different?
Yeah, it's completely different. So maybe 2 to 3% of the population suffer from psoriasis, so it's not as common. And you can see these are more well set, sort of differentiated. You know, you can draw a nice line around them. They tend to be kind of silvery plaques on a red base.
Right.
The body psoriasis is often not itchy, although it can be. But if it's on the scalp, the palms, it can be very itchy. The bit about diet that I was going on to was actually leading on to back onto acne, and it's interesting that we're now onto psoriasis from eczema.
Yeah.
Yes, you're right about recent data saying this. I think the most common theme I've seen personally in the journals is processed diets, high sugar diets. It seems to just have a cascade of negative effects in the body. We're now learning more and more about the connection between gut health and skin.
And what about the lack of water? Because, you know, we used to get told a lot when I was younger that what you put in your body is what would come out and how it would reflect on your skin. And we drank a lot of water, and I feel like younger people now will not drink water. It's all about soda and energy drinks and high sugar intake.
I'm sure. I mean, you're absolutely right. And I've seen, sadly, even when I was working in general practice, babies being brought in with Coca-Cola in bottles. No joke. And that is a factor. Obviously, in psoriasis, Suki, as you probably know, that the cell cycle is sped up about 7 times. So that's why you see all this sort of scaly appearance on the surface, because the cells are just turning over too fast. We don't know of anything in the diet that's going to suddenly switch off that process. All I can say is that if you follow a healthy, well-balanced diet, then it can only help your overall health. But the main thing I would say for all skin conditions that we haven't touched on is managing stress. Because stress is the single common factor that exacerbates.
Excuse me.
Okay, let's thank you, Suki. Similar to eczema, many people are affected by rosacea. Now, Kate Louise from Wigan has been in touch with us. She says, I have rosacea on my face. I'm not sure when it started, but I think it was after my daughter was born. It gets worse when it's both really cold or really hot. I've tried lots of different creams and lotions, but nothing seems to work. And actually, we've got a couple of photos from Kate Louise's face, which are here. So tell us a little bit about rosacea. Is it the sort of red, sort of tiny veins that we can see on Kate Louise's cheek there?
There's a few features. So yeah, these we call telangiectasia, and they're little tiny fine capillaries. You'd also have a background of redness, which tends to focus on the central part of the face. And then, of course, flushing is quite key in the story. And flushing episodes would tend to be more than 10 minutes in duration. She's touched on the key thing, which is triggers. So, you know, alcohol, exercise, stress, hot baths, hot showers, changes in temperature, windy weather, spicy food. Any of these, not necessarily all of them, can be potential triggers, which will help us with the diagnosis, because there's no actual test for rosacea.
I've got to say, it's one of the nicer names of all the complaints, isn't it? It's a beautiful name for a girl, rosacea.
Rosacea. Yeah, I don't think you should pick that one.
No, mate. Yeah.
You mentioned stress, which can be behind all of those sort of irritations, eczema, acne. Why is that? Does stress release a certain sort of hormone or chemical that exacerbates everything? Do we know?
Yeah. Yes, absolutely. It is all kind of linked to hormones. When we are stressed, our cortisol goes up. Various other hormones and what we call peptides, so protein messengers, if you like, in the body, get released, particularly in things like rosacea, but actually in all of us, our nerves actually release various peptides. And those peptides can then speak to the blood vessels, make them dilate in case of rosacea, and that causes the flushing.
OK. I know we've got plenty of calls. We're going to try and get through as many as we can. Let's talk about another common condition. Around 20% of people suffer from hives at some point in their life. Tell me about hives. I'm not quite sure what they would look like or what would cause them.
So hives, the medical term is urticaria. And I think all of us as kids have experienced hives when we've got stinging nettle rash.
Right, OK.
So, yes, that's it. So yeah, generally an allergen, so something that can cause an allergic reaction, either comes into contact with your skin, for example, if you touch the nettles, or it could be ingested. For example, if you know, it might be a drug like penicillin, or it might be strawberries in you know, someone's case. And then you get this massive release of histamine, which is a chemical released by a certain type of cell called the mast cells. And that's why antihistamines are often the mainstay of treatment.
Right.
And under specialist guidance or a prescriber's guidance, we can actually sometimes use very high doses of antihistamine to have to get on top of it.
OK. Yeah. Well, look, thank you for your calls on this. Stay on the line if you're waiting to speak to us, because we will try and get through all of your calls, your opportunity to ask the doctor. We're continuing your calls on skin issues with Dr Dev Patel, who's still here with us because we've got so many calls on the line. So let's kick off now. Well, we're learning a lot, aren't we?
Absolutely.
We are, I mean,
it's like the holy trinity. It's like internal stress, what you put in your body, a little bit of genetics and DNA, all of that together.
Can I say that I'd never once thought about the fact that why it was called antihistamine? I don't know what I thought, like it was some sort of political stance, like it was pro-histamine. I didn't know that the body released histamine. So, laughing and learning.
There you
go. Right, let's take some more calls. Ria in London. Ria, welcome to the show. Good afternoon. What would you like to ask the doctor?
Hi, I wanted to ask, so I've had these red patches on my cheeks for like just over 2 years. I spoke to a GP and I was prescribed Metrogel, I think it was, like a topical antibiotic, for 6 weeks, I think it was, and it didn't work. I've tried like switching up skincare, moisturisers, all sorts of things, and nothing's worked.
OK.
And that's Ria sent us a picture there.
Yeah. Sorry, Ria, do you mind me asking how old you are?
18.
18, OK. And do you get any flushing? Have you noticed that you flush at all? I don't know if you were listening earlier with any of those triggers, like changes in temperature, hot weather, windy weather.
I think when I get hot, it goes redder, but just generally throughout the day, it will go bright red and then a lot more faint, like I can't even see it, and then it will come back, go away, come back, go away. OK. You would, obviously, from the photographs, it's difficult to say. You would need to, I know you've been to the GP, but you probably need to see someone who's got an interest in skin who can ask you a lot more questions to try and tease out whether you might be, you know, just starting to get rosacea. It's not impossible. It most commonly occurs in sort of the 30 to 40 age bracket, but can occur in an 18-year-old, of course. And then I find a lot of patients just sit on this spectrum of, that's why I was talking about inflammation earlier, that sometimes it's very difficult to put a label on something. And I know people would like that because then they can Google it and try and find something. But we just need to talk about skin health. Ria, to me, is a young person who, you know, I'd want to delve into her lifestyle a bit more, you know, what she's using, what makeup are you using, Ria? You know, that can be a factor. And then actually try and use things that will bring down the inflammation. So, you know, I mentioned growth factors,
vitamin C, but again, you know, vitamin C in the L-ascorbic acid form, which most people use, it actually can be quite irritant in about 10 to 15% of people.
Really?
So I would be using another type of vitamin C. That's why, you know, I get a bit upset with the skincare industry, because marketing can make people like Ria go and end up thinking she's doing the right thing, but actually make
doing
it
something
worse.
That's not helping for her.
Yeah.
So your advice to her is trying to see someone
She needs, yeah,
to see a skin specialist.
Yeah, I'm sorry I can't give you the answer over the phone, Ria. You need a little bit more assessment on the full story, someone to examine your skin properly. And then really, I think just following, I know you've tried lots of skincare products, but there are products out there that I think will help you better. And then hopefully you'll see an improvement. There are obviously in private clinics treatments that she can have, you know, various lasers and light therapy, which she could move on to.
Okay. Ria, thank you for your call. Let's move on to another. Neil's got in touch from London. Neil, good afternoon. What's your question for the doctor?
Oh, hi, doctor. Yeah, the problem I had is with my feet, and the skin on my feet is I've got cracked heels, so the skin is just becoming so dry that it opens, and also it's very itchy on the right foot, and I'm scratching so much that I'm breaking the skin. I heard it could be a liver problem, but I don't think there's anything wrong with my liver. So, but it's the feet, the skin on my feet that I'm a bit worried about in case I get an infection.
Okay, Neil, thank you.
I get this as well, and often weirdly it seems to happen that the sort of itchiness it seems to occur during the night. Now I don't know if that's just when I'm conscious of it, but I'm interested like Neil is.
Yeah, itching is worse when you're warmer, so that's probably why you're getting itching at night. If I was a gambling man, I'd say it's most likely a fungal infection that you've got, Neil. Obviously, I'd want to see it. And there's 5 different patterns of fungal foot infection, actually, that can present from little blisters to cracking and scaling of the feet to redness. It's not always between the toes, as some people think. So, Neil, I mean, it would be good if someone could see it and let you know, but you've probably got a form of what we call tinea pedis, or fungal foot infection. That's pedis.
Right.
Yep.
Okay. No, you were right to make that point. I was primed.
And the important thing, the reason why people fail, this is one of the most common problems we see, is actually that they might get treatment for their skin, but they're not treating their shoes. So you need to get an antifungal foot spray and spray all your shoes. You need to change your socks as soon as you come indoors, take your socks off.
Right.
And something I rarely see people do is after the shower or bath, dry between your little toes, because that water stays there, and fungus loves moist, warm environments.
Moist and water. Okay, thank you, doctor. Let's move on to another one. Ron in Merseyside. Ron, welcome to the show. What would you like to ask the doctor?
Good afternoon, Alexis. I wonder, I'm 80 years old, and I've got a problem called sebaceous cyst warts. I'm wondering, is there anything I should worry about, or is there any treatment for it? They're appearing on my face now, and also smaller versions on my torso. But the ones on my face, I've got quite a large one on my back. When the scab falls off, the skin doesn't seem to heal. It just forms a scab again, and it's sort of a continuous cycle. Okay. Is there anything I can do about getting it seen to, or is there any cure for it, or is it an old age thing?
All right, Ron, thank you for your question. Sebaceous warts.
Yeah, I think it's probably seborrheic warts that Ron's talking about. They're sort of dark brown to black, probably, Ron?
Yes.
Yeah. Proper name is seborrheic keratosis, and pretty much everyone over 40, certainly 50, will develop these.
Yeah.
And most commonly mistaken for melanoma, actually.
Right.
So totally benign. They can be quite unsightly and people want them off. The only thing you can do to try and pare them down, you can use urea or salicylic-based creams that you can get at the pharmacy to try and flatten them down and take off that surface roughness, and even pare them down with a pumice stone. But that can make them bleed. And really, again, like the tags, the only way to really deal with them is to have them removed.
OK. Ron, thank you. Let's take another very quick one. Sandra in Lincolnshire. Sandra, what's your question for the doctor?
Hello. I've got an irritation in my scalp. I've had it since last October. I've seen 5 different doctors, and all they can suggest is I use a coal tar shampoo.
Okay.
Which isn't smoking.
Yeah, and they're very unpleasant, those tar shampoos as well.
Smell.
Itchy scalp?
itchy scalp, it could be, the most common thing is dandruff and dry skin.
Right.
So I'd say moisturising, maybe with certain neem oil, neem, N-E-E-M. You can order it online. Really good, smelly, but it's really good. And otherwise, if there is any rash to be seen, get someone who you know to have a look. If there's any rash there as well, I would see a dermatologist to try and get a diagnosis.
Okay. Look, thank you, Doctor, for all those. We've got through so many calls. Apologies, you two had to sort of sit by and
really
watch
interesting.
the surgery sort of live on TV. Now we're going to move on.